Flu season is off and running in New York State.
First reporting week was early October, 481 cases. Now 24, and that's the week ending November 8th, which is the latest state report out. We should get another one by the end of the week. Joining us now, Upstate Global Health Director, Dr. Stephen Thomas. Always good to see you. Thanks for checking in with us.
Good to be here. Thank you.
We'll dive right into the numbers. Not unusual to see a rise in flu cases this time of year, but how would you interpret the early rise?
Yeah, so, the rate of rise is a little bit concerning, meaning the curve is a little steeper than we like to see at this time of year. I think the thing that is really concerning to people is that the Southern Hemisphere, which has a different season than we do, they got clobbered this year. And I think one of the reasons they got clobbered is because there's this, what they call a clade. It's like a new variant of the H3N2 virus, influenza virus. It's new, and we haven't really seen it before, and the vaccine is not a perfect match, and so it is also the predominant strain that's circulating in the U.S. right now. So I think people are concerned that this is going to be a really horrible flu season.
Are we seeing it yet?
In New York State, I mean, you just mentioned the numbers.
Yeah, right.
There are pockets around the state that are seeing pretty robust transmission of flu right now.
That variant that you were talking about? Or?
So that's national. So New York would be included in that. Okay. Locally, the numbers are definitely going up. Flu being the most. RSV and COVID not so much.
Okay.
So flu is predominantly what we're seeing right now, and I just imagine that that we're going to see that here in our wastewater soon, if not in the samples we're getting from people.
So I would assume still get vaccinated, even though the flu isn't a perfect match this year. You still want to do it, COVID as well, and then the basic hygiene of washing your hands and all those kinds of things.
I love that you always throw that in there, because people forget about the basics, which is, if you're sick, stay home, don't go in public, get yourself tested, constantly wash your hands, wear a face covering, certainly if you're somebody at risk of having a bad outcome, which is, older folks and folks with other medical problems. And yes, the vaccine. So some of the early data from the southern transmission season that we just saw is that the available vaccines reduce the risk of kids having to go to the emergency department or get admitted to the hospital by about 75%, reduce the risk in adults of about 40%. So I would absolutely still consider getting vaccinated, even though it's for flu, even though it's not a perfect match. And then as it relates to COVID, again, we're not seeing a lot of transmission right now, which is good because it gives you time to consider going to get your updated vaccine, which we think is going to be a good match for what is circulating.
Yeah, so just because the numbers are low doesn't mean don't go get vaccinated.
No, absolutely. Yeah. We've seen this sort of bimodal seasonal transmission every year where we see a summer surge, we see a winter surge, so now would be a good time to think about getting that.
Right. We want to hear your take on Canada losing its measles elimination status. What does that mean, and what will that mean for the U.S.?
Yeah, well, it's not good, I can tell you that, and if things continue as they are in the United States, we will be joining them in January. Because it will have been a year since we had the first outbreak of measles down in Texas, and it has been continuously transmitted throughout the year, and after a year, you lose your status. So, so Canada's lost a 27-year run of not having measles. We're going to lose a 25-year run, and it's primarily related to decreases in vaccination.
Can I get your thoughts on that, and being an infectious diseases specialist? Here we had elimination status, and now we could lose that.
Yeah, it's going backwards. I mean, it's we solved that problem. Right? And just like we solved polio, just like we've solved these other vaccine preventable diseases, and for people to be questioning the problem that we solved means we can't go on to new problems and more important problems, and it really is just going backwards. And I think, when you do when you do these surveys, whether it's the Kaiser Family Foundation or the Pew Research Institute, the majority of the country still believes that vaccination is important. It still believes that it has benefit. They still believe that it's important for kids who are going to school. But when you start getting into the folks who no longer believe that, it starts splitting down some ideologic and political lines, which I think is really unfortunate, because what it means is the misinformation that is out there is sticking with people, and instead of kind of trusting their medical professionals that have taking care of them and their families for their whole life, they're listening to the TV and podcasts and other things.
You are still, though, trying to solve new problems. So what are you working on at Upstate Global Health? What do you have going on now? And I think we're going to pop up an email and a phone number here for people that are interested. What are you guys working on?
Yeah, no, I appreciate you asking. So, yeah, we do about 15 to 20 clinical trials every year, and these clinical trials are what take ideas and potential solutions and bring them to your pharmacy and bring them to your doctor's office. So one thing we're working on is a new treatment for COVID. So people that cannot take for one reason or another the current treatments that are available, this is a new one, and so it's very similar to Paxlovid, which is currently on the market now. But it's a 5-day oral treatment, so it's a pill. You take it at home. It's designed to help people who are at risk for having a severe COVID infection, to reduce that risk and keep them out of the hospital, keep them from getting sick. So that's one that we're actually recruiting for now. And
you need volunteers.
Yeah, we need volunteers. So yeah, so if you get diagnosed with COVID, you should call the number or email us. We'll get back in touch with you immediately and see if you're and see if it's a good study for you to be in. And then the other one that we're going to be starting in December, which is a huge trial. It's going to be over 30,000 people, and we're going to be one of the big sites, which is exciting. There are side effects that people can have from having to go into the hospital or from taking lots of antibiotics. People can get gastrointestinal problems, right? It's called C. difficile, C. diff, right? It kills a lot of people every year. And I can tell you from practicing in this area, we have a lot of patients who get this and who don't do well. Well, there is a vaccine that's already been tested in tens of thousands of people, and this is the last big trial to show that it works. So we'll be starting that one very soon in December. I think we're going to start recruiting people. But people should feel people use the phone number, use the email. We can tell you about everything that's going on. But yeah, we've got a great team. It's exciting.
Awesome. It is exciting. So glad this work continues. Thank you, Dr.
Thank you.
Thomas.